Dr. Vic Goradia. I'd like to tell you about a new advancement in ACL surgery. This new technique allows us to primarily repair the torn ACL instead of having to replace it. This is also known as ACL preservation surgery. This is a front view of a knee model. Here's the kneecap in the front, with the thigh bone on the top and the leg bone on the bottom. As we move the kneecap out of the way, one of the things that we'll see is this brown colored structure known as the ACL, or the anterior cruciate ligament, which connects the tibia bone down here with the femur bone up top. In certain situations, when the ACL tears from the femur site up here and it pulls away, what we're able to do is place sutures in the ACL and reattach it back to the bone. In the case of the preserve ACL surgery, what we do is place a amnion sponge between the ligament and the bone. This amnion sponge contains some natural growth factors that help in the healing process.